right, good morning. Last time we talked, it was the beginning of biology, and we had discussed one of the learning goals, which is to learn about human health in general and how we try to keep the population as healthy as possible. There are lots of reasons and benefits to have a healthy population. And one of the pieces is access to medical technology. And I chose to start with that because it sort of overlaps with optics in a few ways, in the senses that you're talking about creating images and using usually elements of the EM spectrum to be able to view inside the body without actually opening the body up. So we talked about X-ray machines, CT scanners, MRIs, ultrasound machines, how we have these things, some of them in our local hospitals, and some of them we don't, and how access to those can help lead to proper treatment and improving your health as an individual. So, to just add on that for a moment before we get into the next piece for today, I have a little list here of the steps that are kind of important in something is wrong and how do you get to being healthy again. So, we're not going to write these down, but I did just want to touch on them. It is sort of the sequence of events that would happen realistically if you needed to have some imaging done. So, step one is you realize there's some kind of problem medically and you want to determine what the issue is and then treat it appropriately. So, the first thing that has to happen usually is that tests are ordered. And what kind of tests are ordered has lots of factors to it. One could be access. So, what machines are available locally to be used, cost, the downsides of sort of repeating those tests over and over, like we talked about the X-ray machine. I should have mentioned, I totally forgot. X-ray machines used to be used all the time in ways you may not have realized. My mother-in-law has a story about how when she was young, there was actually an X-ray machine in the shoe store. So the idea is you could put your foot in this X-ray machine and then they could look at your bones and then figure out the best shoe for you based on your bone structure, which is not actually necessary, but I'm sure was like a way to get people in and sort of sell some product and a neat feature for your store. But they used to just play with it all the time, stick different body parts in there, do different x-rays. That is frowned upon now because of the increased exposure to that part of the EM spectrum. And of course, that part comes with a little bit more risk because it can damage DNA, and buildup of damage over time can lead to cancer. So, but just that's part of the risk benefit. Okay, we're going to use it when it's needed. It's got lots of benefits to being accessible to us, but there can be downsides to overexposure, as we talked about. So, first of all, what kind of tests can you get quickly? What kind of things are available in your area, and maybe what's needed? Do you need an MRI right off the bat? Because MRIs are harder to get access to. You may have to wait a long time. It's obviously more expensive. Not that you pay out of your pocket, but still for a system, those kinds of things. So, ordering the proper tests and then preparing for your test. So, if you've gone in before, sometimes there's no preparation required, other times there are. So, for example, if you're going in for your ultrasound, one of your ultrasounds, to watch the development of a baby, then you have to drink a whole bunch of water before you get in there. And then you have to hang on to that as part of them being able to get good results and see lots of stuff in there by the bouncing off of the sound waves. That full bladder helps them get good images, although it is super hard to get through if you've ever been through that. Not for pregnancy, maybe, but for other reasons. And then sometimes you have to drink something. So we talked about how some of the tests actually watch things move through you, like your intestines. So you might have to fast and then you might have to drink something. So that is the next part to getting a good image. The next thing is that your technician administers the test properly. And so you can get trained for this. You can go to school to learn how to use these machines, how to work with people, how to read the images. As a potential healthcare career that you might want to pursue. So it seems like a really great one to me as something that's potentially beneficial. And then somebody has to read that image, as I said. So you have your tech administer it. Usually in the test, they don't say much to you about what they're seeing or anything like that. That is saved for somebody else to sort of take the images away, use their expert eye to go through and see what they see, and then send a report back about what they've discovered or what they haven't discovered. And then maybe further testing from there, okay, to something that's maybe a little bit more expensive, a little bit more high detail, a little bit more thorough, if they didn't see what they needed to see from the first series of tests. Okay, all of this relies upon adequate funding. Our system is a public healthcare system. So what that means is it's available to everyone, which is wonderful. You go to the hospital. It's not like you get a bill for going to the hospital, but the money that funds that system comes from taxpayer dollars and also donations. Sometimes there's campaigns for people to donate to raise money to build a machine, to buy a machine to have locally. And so it's always reliant on what your community maybe can afford and what the system can afford. So that's why we don't have an MRI machine, for example, in every hospital in Ontario. Okay, and also why they think carefully about what tests they're going to order and how many, because of that funding piece as well, is a reality of our system. So moving on, the main focus of today, I'm just looking around for my pen, wherever I put it, is to talk about, look, it's just like I'm in class. I can't find my pen. Oh, it's been too long, people. Okay, is public health strategies. And this is pretty relevant to what we're living through right now. So we have this structure called public health, and it works towards keeping, like I said, the general population as healthy as possible. So we're going to move to our note right now. We're just going to write down a few brief things today. Public health strategies. And I don't think you're going to see me write too much today. Okay, we're just going to talk about different approaches that can be taken to try and keep the population as healthy as possible. Okay, a healthier population means less strain on the healthcare system. This is a big topic of conversation as we live through this reality right now of what can the health system handle, right? How many people can be sick at any one time? How many people are working in the system? Are they healthy? All those different types of pieces. So the healthier your population is, the better it is long term, because then people don't get sick and end up in the hospital and end up needing supports. And then obviously, because of our public health system, us all trying to keep that afloat and keep that going. All right, so one of the things that is a part of public health is immunization. Okay, so one of the strategies that is used to keep the population healthy is to vaccinate. Vaccinations available at no charge to population. And there's different vaccinations we have. So not everything has a vaccine. Not everything maybe you want to get vaccinated for. So we have some things that are considered more mandatory than others. So for example, if you think of the flu vaccine, there's nothing mandatory about getting the flu vaccine. But there are sort of campaigns that encourage you to get vaccinated for the flu, especially if you're in a vulnerable group, maybe as an elderly person or somebody who works a lot or is in contact with elderly people, or really young kids, or people who are immune compromised, which means they don't have a mechanism that's working very well in their body to fight off an infection if they were to get sick. So there's a little bit of direction about who it makes the most sense for, and encouraging that. But you may know that when the flu vaccine becomes available each year, you often see little signs posted in the grass outside of pharmacies encouraging you maybe to consider getting your flu shot and showing you where it's available, where you can go in to get that, outside of a doctor's office even. There's vaccinations that are considered more mandatory. So you go to school. So maybe you know that as part of that, you have had a moment in time where your parents have gotten a notice saying that your vaccinations are out of date, and that you can't come back to school until they're up to date. There are some people that get excused from that, but that's a general approach the school takes. So those would be things maybe you've had since you were very young. You get a booster every so often, which means you get that reintroduced to you. So your immune system gets up to date in fighting it and go from there. It could be every 10 years or something like that, or maybe you never got a vaccination. So there's things like that, like diphtheria and things you may have never heard of that people, don't get sick from, have been part of a vaccination schedule for the population for a very long time. HPV is one you might have heard of. It's, once again, optional. It starts to be offered usually to girls, probably grade 7, grade 8. I'm not sure exactly, before high school. And that is for human papillomavirus. The reason that it starts getting promoted, especially to girls at that age, is because it's connected to sexual activity. It's an STI. So it's a virus, actually, human papillomavirus, but it can lead to cervical cancer. And it gets passed, like I said, through sexual intercourse. So around the age when that might become more likely, or potential is there that people will be engaging in that, especially as a girl, that vaccination is available to protect you from that. And so we have a whole host of these things. Obviously, right now you might be reading about efforts to make a vaccine. And if we were in class, we'd probably have a much bigger conversation about this, which I'm sort of missing, but that's okay. So that is a strategy, whether you believe in vaccination or not. It is a public health strategy to try and limit different things from moving through our population and keeping people healthy through that strategy. And it's been in place for quite a while. All right, I've said the word campaign a lot, so let's write it down. I feel like I need to look to see how to spell it. Campaigns. And so, like anything, election campaign, whatever, it's an effort to get information out and convince people to do something. If it's an election, to vote for this candidate over another. And so for public health campaigns, what they're doing is they're trying to get information out to the public to educate them on an issue. So if you're going into a restaurant and they serve alcohol, or like a bar type setting, you might be familiar with seeing posters where there's like, a woman and she's obviously pregnant, and it says like, alcohol can have negative effects on a growing baby, for smoking, cigarette packs, and how they're covered in photos of like really nasty looking kind of health outcomes of smoking. We have campaigns in Ontario for ticks, because that's sort of been a recent thing, in the transmission of Lyme disease through tick bites. So you might see posters or hear radio ads or things on TV. You might see things through social media too, ads that are funded by public health to try and tell people what to do, how to avoid them, that kind of stuff. There's also, I can think of West Nile was one not too many years ago. So we have all kinds of things. Opioid use, educate people on the dangers of opioid use. So that's like prescriptions, misuse of prescription painkillers, where to go for support, how to make sure. There was a common one not too long ago. Sometimes I'd be driving to school and I'd hear it on the radio and it would remind me to talk about it in class, about locking up or getting rid of leftover pain medication as a parent, so that your teenage kids or whatever didn't get access to those pills to use them recreationally and things like that. Sometimes if you get like the paper, especially right now, there's lots of public health messages. They look like ads that have been purchased to tell people, like I said, about ticks or opioids or COVID-19 or those kinds of things, and how to avoid them, and what to do if you encounter it, that kind of thing. So some traditional ones, I'm not going to write all those down, would be, I'm going to call it smoking cessation. It's not that a common of a word, but it basically means it's CESSATION, ways to get people to stop smoking if they already are smoking. Vaping, that would be another thing. I feel like more and more we're going to see campaigns that try to educate people on potential risks of vaping. Okay, another one that I was going to note, and this one will seem less dramatic than the others, is sun protection. Okay, so different ways you can protect yourself from the radiation of the sun, because sun cancer was a concern, remains a concern. So once the sun comes out and we move into summer, reminders of how to stay sun safe, they would call it. We will put in here the tick thing, because I feel like that is just starting to come up again. It's the change in season and what to do about that. Ticks. I'm going to put Lyme disease because that is the concern. There's been ticks around for a long time, but ticks in our area didn't always transmit Lyme disease. So that is the new messaging, that there's an added layer of risk and how to avoid this leading to this. Okay, so like I said, I could keep going, but I'm not. So basically a campaign is just, maybe I should do another thing here. I'm not writing a lot, I'm talking a lot today. But a campaign could involve, let's say, newspaper, ads, radio. I'm calling them ads. They're not trying to sell anything though. They're just trying to educate. I could put posters that you might see in public areas, libraries, like I said, restaurants, bars, obviously your doctor's office, those kinds of things. Sometimes they send out flyers, things you would receive in your mailbox, with information. What kind of other things do I say? Sometimes I'll have like a community health, like you can come and listen to this expert or come out to this night to learn more, things like that. But we'll just leave it at that. You kind of, I think, get the idea from that, hopefully. Okay, what did I want to put else down here? Oh, screening programs are another way to keep your population healthy. So what happens here is there's different ways of doing this. If you're sort of in an at-risk group for something, some people, depending on what your background is, you might be more at risk for some genetic disorders than others. So you might get screened for something from a very young age, just to see if it's been passed on through your genetics to you so that you get proper treatment sooner than later. But screening programs, most of them kick into play as you get older. So for example, they screen a lot for certain kinds of cancers. I'm going to put breast and prostate, breast/prostate cancer. The idea would be that as you get older, your risks increase. And so they offer you the option to be screened to see if you're developing these things before you would know you were developing these things, so that you get treatment early and increase your chances of survival or not being as dramatically impacted by the disease as you would be if it got to a later, more advanced stage. There's a particularly interesting example, and maybe this is a little dated because I can't remember how many years ago it was, but Angelina Jolie, famous actress, got herself screened for breast cancer because it was in her family. So she chose to get the screening, found out that she had quite a high risk to develop breast cancer, and chose a double mastectomy, which means she had both her breasts removed in advance of any cancer development. And then I think there was some cosmetic surgery pieces to replace that. So that was how she avoided. So that is one quite dramatic outcome of screening. But like I said, once you get to a certain age, what typically happens, or once you become high risk for something, you get like usually through the mail, you get something mailed to you from the government that says, that this screening program is now available to you, and then you can follow up, get the test, and see where you're at. So all this stuff is about being proactive. So all of these things I'm mentioning are about getting ahead of any type of disease so that you stay healthy and you never actually have a negative health outcome. So with vaccination, you do this so that you never actually get the virus, for example. The campaign is if maybe you alter your activities or change your behaviors, you won't actually suffer from things like lung cancer, skin cancer, Lyme disease, and opioid addiction, all of these different things, heart disease, type 2 diabetes, all that kind of stuff. Sometimes there's even just campaigns about being active, because being active can combat so many things, like I just mentioned. I'll try and find a clip of, there used to be when I was a kid, maybe you've seen this before, commercials, like really between your programming that would come on in Ontario. This couple who would try and convince people in Ontario to get active, participation. So I'll try and find one of those to add if I can later. All right, so screening too, same thing. If they find it early, then it can eliminate a lot of more serious intensive treatment than if something was at a later, more advanced stage. Oh, colonoscopies. Let's put that down here. It's another screening for cancer. But I'm going to say that you might be familiar with that. I feel like you guys are so young. You're probably like, what? But I know definitely lots of people who have gone in for this, and it is proactive. It's just to take a look around. We talked about how you can scope, you get a little camera, a little light, you go up or you go down. In a colonoscopy case, you go up, and the idea is you're taking a look around for growths or anything out of the normal tissue that looks damaged or things like that. And then taking action before anything gets too serious or more advanced. But that's a common screening thing. And we have access to that in our local hospital, as I kind of showed you. So that one, you might know people who've gone in for those, usually older adults, but not necessarily. Sometimes you might have had this, not the colon one, for other reasons. Okay, the last one we're going to put here is education. Through school curriculum. So the government of Ontario has decided, when they make the curriculum, they make lots of decisions. When they're doing usually phys ed, but not always just phys ed, they include things so that while you're at school, you learn about this stuff, and that will hopefully allow you to have a healthier life style and be less sick through the course of your life. So, for example, you would have been educated at some point about STIs, okay, sexually transmitted infections, and the ways that you avoid those things and or treat those things, consequences of being in contact with the different varieties, and what that means for you long term. So like I said, they would usually start that education at a time they think is like age appropriate and also realistic to maybe the activities that people might be engaging in, and trying to make sure that students have the information when they need it to protect themselves and make smart choices. Also, nutrition. Okay, I could put physical activity. But these kinds of pieces that you would have found were things that got discussed as part of the curriculum at different points in your schooling. Okay, so that is another way to talk to your general population about how to lead a healthy life. And because pretty much everybody goes through this system, if you put it in the curriculum, if you write it into the documents that determine what you're going to learn at school, then you know that people will have that information as they continue to go through the rest of their life. Once you're out of school, obviously it gets harder to update and let people know what is happening, and that's why most of these are focused towards adults, I would say, not exclusively, but mostly. And then these two things are more through like your doctor's office and that kind of ongoing care. Okay, so I think that's going to be it for today. A lot more talking than writing. Hopefully, a lot of that makes sense and you can make connections to what you know, what you've experienced, to the kind of things I'm saying. I've definitely left out examples, and I wish we could have a conversation today to like go back and forth and talk about so much. But so it is. I found an interesting question in your textbook today. Your textbook was probably written, I'm going to say like 2003, early 2000s. Let me check for you because I'm sure you really want to know. What does it say? 2009. Okay. It's more recent than I thought. Anyway, there's a question in here that I am going to post as a one thing to follow up for the end of the week. It's in the chapter 3 review, and I will write it out. But the question is, believe it or not, a new virus is suspected to be affecting the population of a major city. What could government and medical professionals do to limit the spread of the virus? So I feel like you shouldn't have to do any research here. That should be able to pound that one out pretty easily, hopefully. The other one was explain why the World Health Organization, which we all might be a little bit more familiar with now, thinks that vaccination is one of the most cost-effective health investments. So why you would want to put your money in making vaccines. The other thing would be to wait for people to get sick and then pay to work them through their treatment and help them recover, or possibly care for them long term, depending on how they're impacted by whatever they get infected with. But I think I'm just going to go for one today. Okay. There's so much potential for conversation here. There's questions like this all through here, where in a different year, people would just be walking through, but you can actually go, I see it. It's never been more connected to my life right now than it's just unfortunate we can't talk about it. All right. So there you go. Obviously, I'm missing you today. I'm going to leave it like that. Like I said, I'm just going to put the one question just for you to put your thoughts on paper and see that. But I could pick any number of things. If you actually don't want to think about the virus, just put down something alternate. Talk about a campaign, a place you've seen a campaign for something, whether it's ticks or smoking or drinking or whatever you want to do. And I'll take that as a substitute. Okay. So next week, we're going to talk more about the nitty gritty. We're going to start going through how the body is built and the interaction of things within the body, and take it from there. So I hope you enjoy the sunshine, this summer type weather, if you're looking at this today. If not, hopefully it's still nice whenever you watch this. And we will connect again next week. So take care, everybody. I'm definitely missing you today.